Introduction to Nutrition Science. Nutrition science is the study of how food and drink affect the human body, encompassing the processes of ingestion, digestion, absorption, metabolism, and excretion. It investigates the physiological and biochemical functions of nutrients, their interactions, and their impact on health and disease. This field integrates knowledge from biology, chemistry, physiology, and public health to understand the complex relationship between diet and well-being. Understanding nutrition is crucial for maintaining optimal health, preventing chronic diseases, and promoting overall quality of life. It provides the scientific basis for dietary recommendations and public health policies aimed at improving nutritional status across populations. The discipline continuously evolves with new research, offering dynamic insights into human health. The primary goal of nutrition science is to identify the specific nutrients required for human growth, development, and maintenance, as well as the quantities needed for various life stages and activities. It also examines the consequences of nutrient deficiencies or excesses, which can lead to various health problems. This scientific approach helps to debunk myths and provide evidence-based guidance for dietary choices. Furthermore, nutrition science explores how dietary patterns influence disease risk and recovery, contributing significantly to preventive medicine. It empowers individuals and communities to make informed decisions about food, fostering healthier lifestyles and reducing the burden of diet-related illnesses. Macronutrients, carbohydrates. Carbohydrates are the body's primary source of energy, essential for fueling cellular functions, muscle activity, and brain function. They are organic compounds composed of carbon, hydrogen, and oxygen, categorized into simple and complex forms. Simple carbohydrates, like sugars, provide quick energy but offer minimal nutritional value beyond calories. Complex carbohydrates, found in whole grains, legumes, and vegetables, are rich in fiber and provide sustained energy release. Fiber, a type of carbohydrate, is crucial for digestive health, promoting regularity and helping to regulate blood sugar levels. A balanced intake of carbohydrates is vital for maintaining energy levels and supporting overall physiological processes. Excessive intake of refined carbohydrates can contribute to health issues, while adequate complex carbohydrate consumption is beneficial. Macronutrients, proteins. Proteins are fundamental building blocks of the body, playing critical roles in virtually every biological process. They are large, complex molecules made up of smaller units called amino acids, linked together in long chains. There are 20 different amino acids, 9 of which are considered essential because the body cannot synthesize them and must obtain them from the diet. Proteins are vital for muscle growth and repair, enzyme production, hormone synthesis, and immune function. They also transport nutrients, maintain fluid balance, and provide structural support to cells and tissues. Adequate protein intake is essential for children's growth, athletes' recovery, and maintaining muscle mass in older adults. Diverse protein sources ensure a complete amino acid profile for optimal health. Dietary protein sources include both animal and plant-based foods. Animal sources like meat, poultry, fish, eggs, and dairy products are considered complete proteins, containing all essential amino acids. Plant-based sources such as legumes, nuts, seeds, and whole grains can also provide sufficient protein, especially when consumed in varied combinations to ensure all essential amino acids are obtained. For example, combining rice and beans provides a complete protein profile. The quantity and digestibility of protein sources can vary, influencing their bioavailability. Understanding protein requirements and sources is key to constructing a balanced and healthy diet, supporting all bodily functions effectively. Macronutrients, fats and lipids. Fats or lipids are crucial macronutrients that serve multiple vital functions in the body, including energy storage, hormone production, and absorption of fat-soluble vitamins. They are also essential for maintaining cell membrane integrity and providing insulation to regulate body temperature. Dietary fats are broadly classified into saturated, unsaturated, monounsaturated and polyunsaturated, and trans fats, each having different effects on health. Unsaturated fats, particularly omega-3 and omega-6 fatty acids, are considered essential as the body cannot produce them and they must be obtained through diet. These essential fatty acids are critical for brain function, inflammation regulation, and cardiovascular health. Choosing healthy fat sources is paramount for long-term well-being. Sources of healthy fats include avocados, nuts, seeds, olive oil, and fatty fish like salmon. Saturated fats are primarily found in animal products and some tropical oils, while trans fats are often artificially created through hydrogenation and are generally considered harmful to health. Understanding the different types of fats and their dietary sources is crucial for making informed food choices. While fats are calorie-dense, providing 9 calories per gram, they are indispensable for numerous physiological processes. Moderation and selection of beneficial fats are key to a balanced diet, supporting overall health without contributing to adverse conditions. Balancing fat intake is a cornerstone of nutritional science. Micronutrients, vitamins. Vitamins are organic compounds that the body needs in small amounts for various metabolic processes, growth, and overall health. They are categorized into 2 main groups: fat-soluble vitamins, A, D, E, K, and water-soluble vitamins, C and B complex vitamins. Fat-soluble vitamins are stored in the body's fatty tissues and liver, meaning they can accumulate and potentially become toxic if consumed in excessive amounts. Water-soluble vitamins are not stored in the body and are excreted in urine, requiring regular intake to prevent deficiencies. Each vitamin has specific functions, ranging from supporting vision and bone health to aiding energy production and immune function. A diverse diet is the best way to ensure adequate vitamin intake. Vitamin A is crucial for vision, immune function, and skin health, found in carrots and sweet potatoes. Vitamin D supports bone health and immune function, often synthesized with sunlight exposure. Vitamin E acts as an antioxidant, protecting cells from damage, abundant in nuts and seeds. Vitamin K is essential for blood clotting and bone health, present in leafy greens. Vitamin C is vital for immune function, collagen synthesis, and antioxidant protection, found in citrus fruits. B vitamins play key roles in energy metabolism and nerve function, widespread in whole grains and meats. Understanding these roles helps in dietary planning. Micronutrients, minerals. Minerals are inorganic elements that the body needs for various physiological functions, including bone formation, nerve transmission, muscle contraction, and fluid balance. Unlike vitamins, minerals are not destroyed by heat or light, but their bioavailability can be affected by other dietary components. They are classified into major minerals, macrominerals, and trace minerals, microminerals, based on the amounts required by the body. Major minerals, such as calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur, are needed in larger quantities. Trace minerals, including iron, zinc, iodine, selenium, copper, manganese, fluoride, chromium, and molybdenum, are required in smaller amounts. Both categories are equally vital for health. Calcium is essential for strong bones and teeth, found in dairy and leafy greens. Iron is crucial for oxygen transport in blood, abundant in red meat and fortified cereals. Zinc supports immune function and wound healing, present in nuts and legumes. Iodine is vital for thyroid hormone production, found in seafood and iodized salt. Sodium and potassium are key for fluid balance and nerve impulses, common in many foods. Magnesium participates in over 300 enzymatic reactions, found in whole grains and dark chocolate. A diverse diet ensures adequate intake of these essential minerals, preventing deficiencies that can lead to various health problems. Balancing mineral intake is critical for overall physiological well-being. Water, the essential nutrient. Water is arguably the most critical nutrient for human survival, making up approximately 50 to 70% of an adult's body weight. It is involved in virtually every bodily function, serving as a solvent for nutrients, a medium for chemical reactions, and a lubricant for joints. Water also plays a crucial role in regulating body temperature through sweating and respiration. It helps transport nutrients to cells and remove waste products from the body, primarily through urine. Maintaining proper hydration is essential for cognitive function, physical performance, and overall physiological balance. Even mild dehydration can impair concentration and energy levels, highlighting water's indispensable role. Consistent water intake throughout the day is recommended for optimal health. The body loses water continuously through various processes, including urination, defecation, sweating, and breathing. Therefore, a consistent intake of fluids is necessary to replenish these losses and prevent dehydration. While plain water is the best source of hydration, fluids can also be obtained from other beverages like milk, juice, and herbal teas, as well as from water-rich foods such as fruits and vegetables. Individual hydration needs vary based on activity level, climate, and health status. Monitoring urine color can be a simple indicator of hydration status, with pale yellow suggesting adequate intake. Understanding and prioritizing water intake is a fundamental aspect of nutrition science. Energy balance and metabolism. Energy balance refers to the relationship between energy intake, calories consumed from food and beverages, and energy expenditure, calories burned through bodily functions and physical activity. When energy intake equals expenditure, weight remains stable. A positive energy balance, where intake exceeds expenditure, leads to weight gain, while a negative energy balance results in weight loss. Metabolism is the sum of all chemical processes that occur in the body to maintain life, including breaking down food for energy and building and repairing tissues. The basal metabolic rate, BMR, is the number of calories the body needs to perform basic, life-sustaining functions at rest. Understanding energy balance and metabolism is fundamental to weight management and overall health. Factors influencing energy expenditure include BMR, the thermic effect of food, TEF, and physical activity. TEF is the energy required to digest, absorb, and metabolize food. Physical activity, ranging from daily movements to structured exercise, accounts for the most variable component of energy expenditure. Hormones, genetics, age, and body composition also play significant roles in regulating metabolism and energy balance. For instance, muscle tissue burns more calories at rest than fat tissue, influencing BMR. Achieving and maintaining a healthy weight involves carefully balancing these components through dietary choices and regular physical activity. This intricate interplay dictates how the body utilizes and stores energy. Digestion and absorption. Digestion is the complex process by which the body breaks down food into smaller molecules that can be absorbed and utilized for energy, growth, and repair. It begins in the mouth with mechanical chewing and chemical breakdown by salivary enzymes, then continues in the stomach where gastric acids and enzymes further break down proteins. The partially digested food, called chyme, then moves into the small intestine, which is the primary site for nutrient digestion and absorption. Here, enzymes from the pancreas and bile from the liver aid in breaking down carbohydrates, proteins, and fats into their simplest forms. This intricate process ensures that essential nutrients become available to the body's cells. Efficient digestion is crucial for nutrient utilization. Absorption is the process by which these broken down nutrients pass from the digestive tract into the bloodstream or lymphatic system. The small intestine, with its vast surface area provided by villi and microvilli, is highly efficient at absorbing most nutrients. Carbohydrates are absorbed as monosaccharides, proteins as amino acids, and fats as fatty acids and glycerol. Water and electrolytes are primarily absorbed in the large intestine. Once absorbed, Nutrients are transported to various cells and tissues throughout the body to fuel metabolic processes. Any undigested material and waste products are then eliminated from the body. Understanding this journey is key to appreciating how diet impacts health. Dietary guidelines and recommendations. Dietary guidelines provide evidence-based recommendations for healthy eating patterns to promote health, prevent chronic diseases, and meet nutrient needs. These guidelines are typically developed by governmental and health organizations, tailored to the specific populations and food cultures of different countries. Common themes across global guidelines include emphasizing whole foods, such as fruits, vegetables, whole grains, and lean proteins, while limiting saturated and trans fats, added sugars, and sodium. They often suggest balancing calorie intake with physical activity to maintain a healthy weight. These recommendations serve as a practical framework for individuals to make informed food choices and for public health initiatives to improve population health. Adherence to these guidelines can significantly reduce disease risk. Examples of prominent dietary guidelines include the U.S. Dietary Guidelines for Americans, the Eat Well Guide in the UK, and various national food guides represented by pyramids or plates. These guides often visually represent the proportions of different food groups that should be consumed daily. They also typically address specific considerations for different life stages, such as pregnancy, childhood, and older adulthood. The recommendations are regularly updated based on the latest scientific research in nutrition and public health. Understanding and applying these guidelines is crucial for both personal health and for professionals advising others on healthy eating practices. They form the bedrock of practical nutrition advice. Food labels and nutritional information. Understanding food labels is a critical skill for making informed dietary choices and managing health conditions. Food labels provide standardized nutritional information, including serving size, calorie content, macronutrient breakdown, fats, carbohydrates, proteins, and micronutrient percentages, vitamins, minerals. The Nutrition Facts panel is a key component, detailing the amount of each nutrient per serving. Ingredients lists are also crucial as they list components in descending order by weight, helping consumers identify allergens, added sugars, and undesirable additives. Daily value (DV) percentages indicate how much a nutrient in a serving contributes to a total daily diet based on a 2,000-calorie diet. Interpreting these labels empowers consumers to select healthier options. Beyond the Nutrition Facts panel, food labels may also include health claims and nutrient content claims. Health claims describe a relationship between a food component and a reduced risk of a disease or health-related condition, such as lowers cholesterol. Nutrient content claims describe the level of a nutrient in the food, like low fat or high fiber. It is important to critically evaluate these claims, as they are regulated but can sometimes be misleading without a full understanding of the label. Consumers should focus on the factual information provided in the nutrition facts and ingredients list to make the best choices for their individual needs. This knowledge is essential for navigating the complex food environment effectively. Nutritional assessment methods. Nutritional assessment involves systematic methods to evaluate an individual's nutritional status, identify deficiencies or excesses, and develop appropriate interventions. These methods are crucial for clinicians, dietitians, and public health professionals. Common assessment techniques include dietary intake assessment, anthropometric measurements, biochemical analyses, and clinical examinations. Dietary intake assessment involves collecting information about food and beverage consumption, often using tools like 24-hour recalls, food frequency questionnaires, or food diaries. These tools help estimate nutrient intake and identify dietary patterns. Accurate dietary assessment is foundational for understanding an individual's nutritional habits and needs. It provides the initial data for personalized nutrition plans. Anthropometric measurements, such as height, weight, body mass index, BMI, waist circumference, and skin fold thickness, provide insights into body composition and growth patterns. Biochemical analyses involve laboratory tests of blood, urine, or tissue samples to measure nutrient levels, enzyme activities, and metabolic markers. Clinical examinations involve assessing physical signs and symptoms that may indicate nutritional deficiencies or toxicities, such as skin changes, hair loss, or edema. Combining these methods provides a comprehensive picture of an individual's nutritional status. This multifaceted approach allows for accurate diagnosis and tailored nutritional support, ensuring effective health management. Each method offers unique insights into different aspects of nutrition. Nutrition through the life cycle. Pregnancy. Nutrition during pregnancy is critically important for both maternal health and fetal development, influencing the baby's health outcomes throughout its life. Adequate intake of specific nutrients is essential to support the rapid growth and development of the fetus, as well as to meet the increased physiological demands of the mother. Key nutrients include folate, which prevents neural tube defects, iron, to support increased blood volume and prevent anemia, and calcium and vitamin D for fetal bone development and maternal bone health. Protein requirements also increase to support tissue growth. A balanced and nutrient-dense diet is crucial, often supplemented with prenatal vitamins to ensure all needs are met. Avoiding certain foods and substances is equally important. Pregnant women should prioritize whole foods, including a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Specific dietary considerations include avoiding raw or undercooked meats, certain types of fish high in mercury, unpasteurized dairy products, and excessive caffeine. Maintaining a healthy weight gain during pregnancy is also important, as both insufficient and excessive weight gain can lead to complications. Regular consultations with healthcare providers and registered dietitians can help ensure optimal nutritional status throughout pregnancy. This period represents a unique window for nutritional intervention, significantly impacting long-term health for both mother and child. Proper nutrition lays the foundation for a healthy start. Nutrition through the life cycle. Infancy and childhood. Nutrition during infancy and childhood is fundamental for healthy growth, cognitive development, and establishing lifelong eating habits. Breastfeeding is recommended as the optimal source of nutrition for the first 6 months of life, providing essential nutrients, antibodies, and promoting bonding. When breastfeeding is not possible, iron-fortified infant formula is a suitable alternative. Around 6 months, complementary foods are introduced, gradually transitioning infants to a diverse diet while continuing breast milk or formula. These first foods should be nutrient-dense and offered in appropriate textures to prevent choking hazards. Introducing a variety of foods early helps prevent allergies and promotes acceptance of different tastes. This period is crucial for setting developmental trajectories. As children grow, their nutritional needs continue to evolve, requiring a balanced intake of macronutrients and micronutrients to support rapid growth spurts and increasing activity levels. Establishing regular meal and snack times, offering a variety of healthy foods, and involving children in meal preparation can foster positive eating behaviors. Limiting sugary drinks, processed snacks, and excessive screen time during meals is also important. Addressing picky eating with patience and persistence, rather than force-feeding, helps children develop a healthy relationship with food. Adequate nutrition during these formative years is directly linked to academic performance, immune function, and overall well-being. It builds the foundation for future health. Nutrition through the life cycle. Adolescence. Adolescence is a period of rapid growth and development, second only to infancy, characterized by significant hormonal changes and increased nutritional demands. Teenagers require higher amounts of calories, protein, calcium, iron, and zinc to support bone growth, muscle development, and increased blood volume. Calcium intake is particularly crucial for achieving peak bone mass, which helps prevent osteoporosis later in life. Iron needs are elevated, especially for adolescent girls due to menstruation. Despite these increased needs, many adolescents face nutritional challenges, including irregular eating habits, skipping meals, reliance on fast food, and body image concerns. Addressing these challenges is vital for their current and future health. Encouraging a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and dairy products is essential for adolescents. Limiting sugary drinks, processed foods, and unhealthy fats can help prevent nutrient deficiencies and excessive weight gain. Education about healthy eating, portion control, and the importance of nutrient-dense foods can empower teenagers to make better choices. Addressing body image issues and promoting a positive relationship with food is also critical during this vulnerable period. Nutritional interventions should be sensitive to peer influence and independence, fostering healthy habits without creating undue pressure. Supporting adolescents nutritionally helps them navigate this transformative stage successfully. Nutrition through the life cycle, adulthood, and elderly. Nutrition in adulthood focuses on maintaining health, preventing chronic diseases, and sustaining energy levels for daily activities. As individuals transition from young adulthood to middle age, metabolic rates may gradually decrease, necessitating adjustments in calorie intake to prevent weight gain. Emphasis remains on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Specific concerns in adulthood include managing cardiovascular health, blood pressure, and blood sugar levels through diet. Adequate fiber intake is important for digestive health and satiety. Regular physical activity, combined with a healthy diet, is crucial for preventing conditions like type 2 diabetes and heart disease. Proactive nutritional choices are key for long-term well-being. For the elderly, nutritional needs can change significantly due to physiological alterations, such as decreased appetite, reduced nutrient absorption, loss of muscle mass, sarcopenia, and chronic health conditions. Protein intake becomes even more critical to combat sarcopenia and support immune function. Calcium and vitamin D remain vital for bone health, especially to prevent osteoporosis. Hydration is also a common concern, as the sensation of thirst may diminish with age. Dietary interventions for older adults often focus on nutrient density, ease of chewing and swallowing, and addressing potential drug-nutrient interactions. Promoting social interaction during meals can also improve appetite and overall quality of life. Tailored nutrition supports healthy aging and independence. Weight management principles. Weight management involves adopting sustainable lifestyle changes to achieve and maintain a healthy body weight, crucial for preventing and managing numerous health conditions. The fundamental principle is energy balance, consuming roughly the same number of calories as the body expends for weight maintenance. For weight loss, a consistent caloric deficit is required, meaning fewer calories consumed than expended. Conversely, weight gain necessitates a caloric surplus. Beyond calories, the quality of diet, including macronutrient distribution and nutrient density, significantly impacts satiety and metabolic health. Understanding individual metabolic rates, genetic predispositions, and behavioral patterns is also essential for effective weight management strategies. It is a complex interplay of physiology and lifestyle. Obesity is a multifactorial disease influenced by genetics, environment, lifestyle, and socioeconomic factors, characterized by excessive body fat accumulation that impairs health. It increases the risk of chronic diseases such as type 2 diabetes, cardiovascular disease, certain cancers, and joint problems. Conversely, being underweight can also pose health risks, including nutrient deficiencies, weakened immune function, and osteoporosis. Therefore, the goal of weight management is not merely weight loss, but achieving a healthy body composition and overall well-being. Sustainable approaches focus on gradual changes, mindful eating, and regular physical activity, rather than restrictive diets. This holistic view promotes long-term success. Weight management strategies. Effective weight management strategies integrate dietary modifications, increased physical activity, and behavioral changes for sustainable results. Dietary approaches often focus on creating a moderate caloric deficit, emphasizing nutrient-dense whole foods, and controlling portion sizes. This includes increasing intake of fruits, vegetables, and lean proteins, which promotes satiety, and reducing consumption of processed foods, sugary drinks, and unhealthy fats. Mindful eating practices, such as paying attention to hunger and fullness cues, eating slowly, and avoiding distractions during meals, are crucial behavioral components. These strategies are designed to be flexible and adaptable to individual preferences and lifestyles, promoting long-term adherence. It's about building sustainable habits. Physical activity plays a vital role in increasing energy expenditure, preserving muscle mass during weight loss, and improving overall metabolic health. A combination of aerobic exercise, for example, brisk walking, cycling, and strength training, for example, lifting weights, is generally recommended. Behavioral strategies also include setting realistic goals, self-monitoring food intake and activity levels, developing coping mechanisms for stress eating, and seeking social support. For some individuals, professional guidance from registered dietitians, doctors, or therapists can be highly beneficial. Sustainable weight management is a lifelong journey that prioritizes health and well-being over quick fixes, focusing on gradual, consistent progress. It requires patience and commitment. Sports nutrition basics. Sports nutrition is a specialized field that focuses on optimizing dietary intake to enhance athletic performance, support recovery, and maintain overall health for individuals engaged in physical activity. It emphasizes the appropriate timing and quantity of macronutrients, carbohydrates, proteins, fats, and micronutrients, vitamins, minerals, along with adequate hydration. Carbohydrates are crucial for fueling exercise, especially high-intensity or prolonged activities, as they are stored as glycogen in muscles and the liver. Protein is essential for muscle repair and growth, particularly after strenuous workouts. Fats provide sustained energy for endurance activities and support hormone production. Tailoring nutrition to specific sport demands is key. Hydration is paramount in sports nutrition, as fluid losses through sweat can impair performance and lead to heat-related illnesses. Athletes need to consume sufficient fluids before, during, and after exercise to replace lost electrolytes and maintain fluid balance. Pre-exercise nutrition focuses on topping up glycogen stores and ensuring hydration. During exercise, carbohydrates and electrolytes may be needed, especially for prolonged events, to maintain energy and prevent fatigue. Post-exercise nutrition is critical for recovery, emphasizing carbohydrate replenishment to restore glycogen and protein intake to repair muscle tissue. Individualized plans, often developed with a sports dietitian, are essential for maximizing athletic potential and preventing injury. It's a science of fueling performance. Dietary supplements, efficacy and safety. Dietary supplements are products intended to supplement the diet, containing one or more dietary ingredients such as vitamins, minerals, herbs, amino acids, or other substances. They come in various forms, including pills, capsules, powders, and liquids. While some supplements can be beneficial for individuals with specific nutrient deficiencies or increased needs, example, vitamin D for bone health, iron for anemia, many lack strong scientific evidence of efficacy for the general population. The decision to use supplements should be based on individual needs, dietary assessment, and professional advice. It is crucial to remember that supplements are not a substitute for a healthy, balanced diet. They are meant to complement, not replace, whole foods. The safety and regulation of dietary supplements vary significantly across different countries, often being less stringent than for pharmaceutical drugs. This can lead to concerns regarding product quality, purity, accurate labeling, and potential contamination with harmful substances. Some supplements may interact negatively with medications or have adverse effects if consumed in excessive amounts. Consumers should exercise caution, research products thoroughly, and choose reputable brands that undergo third-party testing. Consulting with a healthcare provider or registered dietitian before taking any new supplement is highly recommended to assess potential benefits, risks, and interactions. Informed choices are essential to ensure safety and avoid unnecessary health risks. Prioritizing safety is paramount. Food allergies and intolerances. Food allergies and intolerances are distinct adverse reactions to food with different underlying mechanisms and symptoms. A food allergy is an immune system response to a specific food protein, which the body mistakenly identifies as harmful. This reaction can be severe and life-threatening, involving symptoms like hives, swelling, difficulty breathing, or anaphylaxis. Common food allergens include peanuts, tree nuts, milk, eggs, soy, wheat, fish, and shellfish. Diagnosis typically involves skin prick tests, blood tests, and oral food challenges under medical supervision. Strict avoidance of the allergen is the primary management strategy, and individuals with severe allergies often carry epinephrine auto-injectors. Understanding the difference is crucial for safety. Food intolerance, on the other hand, is a non-immune-mediated reaction that typically involves the digestive system and is generally less severe than an allergy. Symptoms often include digestive discomfort such as bloating, gas, diarrhea, or stomach pain. Common intolerances include lactose intolerance, inability to digest milk sugar, gluten sensitivity without celiac disease, and reactions to food additives. Management usually involves reducing or avoiding the offending food. Rather than complete elimination, small amounts may be tolerated. Unlike allergies, intolerances are not life-threatening. Proper diagnosis is essential to differentiate between allergies and intolerances, ensuring appropriate management and preventing unnecessary dietary restrictions. Accurate identification is key to effective management. Chronic diseases and nutrition. Nutrition plays a pivotal role in the prevention, development, and management of many chronic diseases, which are long-lasting conditions that often require ongoing medical care. Poor dietary patterns, characterized by high intake of processed foods, added sugars, unhealthy fats, and low intake of fruits, vegetables, and whole grains, are major risk factors. Cardiovascular diseases, including heart attack and stroke, are strongly linked to diets high in saturated and trans fats, cholesterol, and sodium. Type 2 diabetes is often associated with diets high in refined carbohydrates and sugars, coupled with sedentary lifestyles. Certain cancers have also been linked to specific dietary patterns and obesity. Understanding these links is crucial for public health. Dietary interventions are often a cornerstone of managing chronic diseases. For cardiovascular disease, recommendations include a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, such as the Mediterranean diet. For type 2 diabetes, managing carbohydrate intake, emphasizing fiber, and promoting weight loss are key. In cancer prevention, a diet high in antioxidants from fruits and vegetables is beneficial. Nutritional guidance can also help manage symptoms and improve quality of life for individuals living with chronic conditions. Registered dietitians play a critical role in providing individualized medical nutrition therapy. Proactive dietary choices can significantly reduce the burden of chronic illness. It's about empowering healthier lives. Public health nutrition focuses on improving the nutritional status and health outcomes of entire populations rather than individuals. It addresses broad determinants of health, including food security, access to nutritious foods, dietary patterns, and the prevention of diet-related chronic diseases on a large scale. Public health nutritionists work to develop, implement, and evaluate programs and policies that promote healthy eating and address nutritional challenges within communities. This often involves collaborating with government agencies, non-profit organizations, and educational institutions. Key areas of focus include reducing malnutrition, promoting breastfeeding, preventing obesity, and addressing micronutrient deficiencies. It's a proactive approach to population health. Strategies in public health nutrition include policy development, such as regulating food marketing to children or implementing nutrition standards in schools. Educational campaigns are also common, raising awareness about healthy eating, food safety, and the importance of physical activity. Community-based interventions, like farmers' markets, community gardens, and cooking classes, aim to improve access to and knowledge about nutritious foods. Monitoring nutritional trends and conducting surveillance studies are crucial for identifying emerging issues and evaluating the effectiveness of interventions. The ultimate goal is to create supportive environments that enable all individuals to make healthy food choices and achieve optimal nutritional well-being. This field is essential for societal health. Sustainable food systems. Sustainable food systems encompass all elements related to food production, processing, distribution, consumption, and waste management, aiming to provide food security and nutrition for all in a way that does not compromise the economic, social, and environmental bases for future generations. This involves minimizing environmental impact, such as reducing greenhouse gas emissions, conserving water and soil resources, and protecting biodiversity. Social sustainability ensures equitable access to nutritious food, fair labor practices, and community well-being. Economic sustainability focuses on viable livelihoods for farmers and food workers, and affordable food for consumers. Transitioning to more sustainable practices is critical for global health and planetary well-being. Key aspects of sustainable food systems include promoting local and seasonal food consumption, reducing food waste, adopting environmentally friendly farming practices, e.g., organic farming, agroecology, and supporting diverse food sources. Reducing meat consumption and shifting towards more plant-based diets can also significantly lower the environmental footprint of food production. Addressing food loss and waste throughout the supply chain, from farm to fork, is crucial for resource efficiency. Policies that support sustainable agriculture, fair trade, and consumer education are vital for driving this transition. By fostering resilient and equitable food systems, we can ensure long-term food security and improve nutritional outcomes for everyone. It's a holistic approach to feeding the world. Current trends in nutrition. The field of nutrition science is constantly evolving, with new research and societal shifts driving various emerging trends. One significant trend is the growing interest in plant-based diets, including vegetarian, vegan, and flexitarian approaches, driven by health, ethical, and environmental concerns. These diets emphasize fruits, vegetables, legumes, whole grains, nuts, and seeds, and are associated with numerous health benefits. Another prominent trend is personalized nutrition, which uses an individual's genetic makeup, microbiome, lifestyle, and health status to provide tailored dietary recommendations. This moves beyond one-size-fits-all advice, aiming for more effective and precise nutritional interventions. These trends reflect a deeper understanding of diet's complexity. Other notable trends include the focus on gut health and the microbiome, recognizing its profound impact on digestion, immunity, and even mental health. Probiotic and prebiotic foods, along with fiber-rich diets, are emphasized to support a healthy gut. The rise of functional foods, which offer health benefits beyond basic nutrition, examples, fortified foods, foods with added omega-3s, is also a key development. Additionally, a renewed emphasis on whole, unprocessed foods and mindful eating continues to gain traction. These trends highlight a shift towards more holistic and individualized approaches to diet and health. Staying informed about these developments is essential for nutrition professionals. The landscape of nutrition is dynamic and exciting. Professional ethics in nutrition. Professional ethics in nutrition guide the conduct of practitioners, ensuring they uphold the highest standards of integrity, competence, and client welfare. This includes maintaining confidentiality, respecting client autonomy, and providing evidence-based information without bias. Nutrition professionals have a responsibility to practice within their scope of competence, referring clients to other healthcare providers when necessary. Avoiding conflicts of interest and refraining from making unsubstantiated claims about products or services are also critical ethical considerations. The primary goal is to prioritize the health and well-being of clients above all else. Adhering to these principles builds trust and maintains the credibility of the profession. Ethical practice is the cornerstone of professional responsibility. Key ethical principles include beneficence, acting in the best interest of the client; non-maleficence, doing no harm; autonomy, respecting the client's right to make their own decisions; and justice, treating all clients fairly and equitably. Nutrition professionals must also stay current with scientific advancements and professional standards through continuing education. They should clearly communicate their qualifications and the limitations of their expertise. Addressing misinformation and promoting accurate nutrition science in public discourse is another important ethical duty. Professional organizations often provide codes of ethics and standards of practice to guide members. Upholding these ethical standards is essential for fostering a trustworthy and effective nutrition profession. It ensures responsible and impactful service.